university, the day on which degrees are conferred, with all due ceremony, is a day no successful candidate will ever forget. 5 years ago, the prospect of being involved in an occasion like this seemed little more than a dream.
Can we go ahead now? Remember, hold your handpiece just like a pen. Hold it further down. That's fine. Good. And remember to use a finger rest when you come in towards the tooth so you're well supported, and hold your mirror in your left hand. That's right. Good. And position that in the mouth. There. Hold it. Get your finger rest right. And good control and the foot control to get the speed right.
Carol decided she wanted to become a dental surgeon after watching her own dentist at work. It takes between 4 and 5 years to qualify. The courses run by different universities differ in detail, but they all set out to provide a university education, as well as theoretical and practical training in all aspects of dentistry. Basic anatomy is one of the subjects covered early in the course.
The rib cage, as you know, is encasing the heart, and it's the heart we're most interested in today. And that gives you some indication of the general size of the heart. Now, in your
students must also learn about the specialist equipment used in dentistry.
Here that takes a complete view of the patient's complete dentition. Rather than taking small individual films, it moves, as you can see, right the way around the patient from one side. And it will end up near you, and the film is then processed, and you'll see the complete dentition on the one film.
Now, there's more gas coming through here than the patient actually absorbs into his body, and therefore we must have a way for it to get out. And it gets out up an inner tube in this device here, and it's regulated by a valve here, which I've at the moment got open.
The next stage is to watch experts at work. When you've mastered the basic rules, you can start to practice what you've learned.
Keep the angle, keep the syringe out, that's it. Good, nice and gently now. Well done.
Right, can you get into the position for work now with your thumbs on the knobs, fingers behind the angle of the jaw, and see how it's going to be. First, we must get the head well back. Now, we've got to watch this bag, you see. If the bag is moving, then the patient is breathing, and all will be well.
Learning dentistry, you'll find you're given responsibility at quite an early stage. You can combine an interest in people with a knowledge of science and make a real contribution to the quality of life. And you'll find that's very satisfying.
I think really I was trying to be sensible about using my science O-levels to the best advantage, to have a professional career, opposed to just a degree in something. I enjoy it, actually. You get to meet, different people, and it's quite a challenge if you get someone who's a bit nervous, etc., and you can sort of calm them down and try and put them at ease. It's quite interesting, really.
So that we can complete our incision.
Modern dentistry is concerned with the prevention of oral disease, but you'll find the work is varied and requires a variety of talents.
When I first decided about doing a career after I'd done my A-levels, I hadn't got a place at university, and I was very keen on working with my hands. In fact, I'd restored a vintage 1934 Austin 7 when I was 16, and I thought that some occupation where I could meet people and continue using my hands would be quite valuable. I find it's a very interesting, very satisfying job.
Okay, just tell me whether you feel anything sharp. You should just feel pushing, okay?
Every patient has a different problem, so you're unlikely to be bored doing the same job twice.
Okay, just squeeze that together.
It's nice to know how to relieve and prevent pain and suffering. And in dentistry, the skills involved can be practiced equally well by men and women.
Well, I like being with people and helping people, and sort of generally I wanted a job working with people. And also, with dentistry, it's a good job for a woman because you can always come back to it after you've had children or whatever. You can always take it up part-time or as a full-time career. So it's quite versatile, really. There's various different aspects to it.
Let's gather on those now.
How is she getting on with the dentures?
Wow.
The training courses cover every aspect of dentistry, including the preparation of dentures and other items used in restorative work. Once qualified, dentists don't make dentures, they're produced by technicians. But as the technicians work to dentists' prescriptions, it's important for a dentist to know how the work is carried out.
Well, Peter, this is the particular shade you've taken, and it's going to be built up from the opaque, the dentine, the incisal, and we may add modifying shades to this crown. Now we'll mix the powders, and then the bridge can be built up starting with the dentine powder.
It's a combination of science and artistry. There are so many different aspects to dentistry, it's not surprising that people decide to study it for many different reasons.
I think it was the chance to see your work through from the start to finish. Because unlike medicine, as a GP, you see your patient come in, then if they don't come back, you've either cured them or killed them. As a dentist, you see the end results. That appears to be quite a good fit. I'll just get the lecturer to have a look.
May I? Thank you.
I enjoy meeting a patient and having a talk,
Yes.
and then actually treating them.
And it's necessary to...
So, in the course of your training, you can expect to get a thorough grounding in basic and applied medical sciences, and in every aspect of clinical dentistry. It's a comprehensive course, but as a university undergraduate, studying isn't the only thing you're likely to be concerned with. Wherever you decide to study, you're likely to find you can take part in almost any sport you care to mention, and join a wide range of clubs and societies. In the limited time available, we can't show you all the activities you can pursue, but it doesn't take long to discover that university life has a style of its own. You'll soon find you feel at home and able to enjoy joining in the many formal and informal events likely to occur in the course of your stay. When you're qualified, you'll find dentistry offers a variety of different careers. Most dentists decide to work in general practice, providing patients with a full range of dental care services.
It's a fascinating career, really, because you have the opportunity to meet so many different patients. And the beauty of dentistry is that you're never doing the same thing twice, day in, day out. So that every patient who comes in presents a new problem, a new challenge, and plenty of interesting opportunities to do intricate work. It keeps your mind occupied. Undoubtedly, general practice is a lot of pressure, but it's challenging, and because it's challenging, it's also rewarding. This is on a 60-second exposure.
A rewarding career offering a good standard of living and an unusual degree of independence. In the hospital service, too, there are plenty of career possibilities. Providing specialist treatment for patients referred by their own dentists, or teaching others to practice the skills you have learned.
So one, tuck it in under the edge, then. You better feed it in, it's easier for you to see. No, use that hand.
There are also opportunities for concentrating on research. As a qualified dental surgeon, you'll find doors open to you worldwide. All the armed services provide dental care for their own personnel. As a services dental surgeon, you'll find you can practice all your professional skills and be involved in other aspects of service life.
Look up the side, check 200 feet.
Whatever service you decide to join, you're likely to find there's plenty of variety.
Let's go, let's go.
So, dentistry today offers exceptional variety. As a qualified dental surgeon working in the forces, in general practice, the community dental service, or a hospital, you could make a real contribution to society and hold a respected position in it.
Loose here? That's fine.
If you'd like to know more about the career Paul decided to follow 5 years ago, ask your own dentist and write to the General Dental Council for further details.
And for the degree of Bachelor of Dental Surgery, Paul John McArdle. With honours, Carol Mason. And Andrew Benedict Moose.